So usually I'll say, oh, do you want to work with this thing a bit more creatively? And then depending on their comfort level, or then I'll be like, okay, well, here's a piece of paper. Would you maybe like to draw this thing out quickly? Or it can be something as just like, drawing a circle and then asking them to put everything that might be on their head just in that circle. It can start with something as small as that, or like something as simple as that, while I then introduce them to what art therapy might be. Um, a lot of the times when a client is opening up about different parts of their life and talking in metaphor, or I will start introducing a metaphor, then that'll give us an image of maybe, a ship in the ocean, or my life is like a certain object, and or a certain, I identify as a certain animal, and then we start using metaphor and symbol to then visualize it, whether it's on paper through drawing, um, or whether it's working with clay to reduce anxiety, whether it's working with collage to vision board to be more future focused. Um, but art therapy in itself is a creative modality that a lot of therapists will work with, um, that doesn't require any artistic skill at all. It is a few different techniques, directives, or a few different activities we can do within session with a client that is it involves very creative thinking. And even if the client is not wanting to think creatively and actually, work on an issue or unpack a challenge, art therapy can be just for relaxation. It can be making strokes and patterns repeatedly. It can be picking colors that are very soothing, and working with those colors. But having said that, it could be that, and it could also be dream analysis. So people dealing with nightmares, people dealing with post-traumatic stress, actually, putting that visual out and being able to manipulate it, being able to change the reality of how they experience a certain visual in their life. So art therapy can come in at with any conversation someone's having. It can come in with body image issues. It can come in with what does a person even think that they look like on paper. But I guess with art therapy, in the way that I work with, just helps to bring a person's problem from here to outside, so they can actually look at it, maybe have a relationship with it, and then go from there. They can That goes hand in hand even with narrative therapy, where the person isn't the problem, so we kind of bring the problem out of the person, and then they have it in front of them. They can work with it, they can change colors of this, they can interact with it differently. Having said that, it works very differently with different ages. So maybe somebody who's very artistically inclined already will have a better understanding of, okay, let's work with metaphor. They have the kind of artistic reasoning to hold their trauma as a symbol. So usually the healing or the change with art therapy will come in once the person is able to interact with the image or whatever that they've created, in a way that we're wanting. So it'll, along with the created image, there's questions that come. We debrief the image together. So, and the change looks very different in different scenarios. But if it's somebody who might have a learning challenge and they know to work with a pattern a certain way, it helps them focus. And if they can bring that into their life on a very regular way, on a regular basis, then they can find, okay, while I play with clay, I can actually hold a conversation. So that helps better their interpersonal relationships. Then generally people can interact with their trauma in a way that's not direct talking about their feelings or talking about exactly what happened. That prevents re-traumatization every time they think of it. Whereas they can now put it out in the form of a metaphor, they can put it out in an image, work creatively with it, and we will close it up, either put it in an envelope, or we'll hold that space for healing with debriefing whatever has come out. So that, and then of course there's people who don't have the language or the vocabulary to even identify what they're feeling, and they can kind of draw it out and work with it creatively in a way that can be addressed, and then they can move on from it. Yeah, as I said, if once we separate the problem from the person, it comes out in a creative way, which is not, it doesn't feel as invasive for a lot of people. And yeah, and then the healing kind of starts from there.